Hi, I'm Dr. Hussein Musa.
Hi, I'm Dr. Adatone Musa.
I'm a board-certified anesthesiologist, pain doctor, and addictionologist.
I am a board-certified epilepsy specialist and neurologist.
And today we're talking about different healthcare perspectives, especially technology in modern medicine, and how it can affect you, your care, and even your physician.
Absolutely. And so we are going to delve into all of the information that is out there in the internet, how available it is, and how to filter through everything.
Yes, that is a tall task. And one thing in medicine is that we're often taught to look at the evidence, and most physicians are practicing evidence-based medicine.
Yes.
That being said, with years of experience, it's also called the practice of medicine. So not everything we do is going to have the highest standard of evidence, but the whole goal is to make sure that you're practicing with proven techniques. But we know that
for the benefit of the patient.
For the benefit of the patient. But we know that medicine is a constantly evolving field, and sometimes there isn't data, and sometimes you just have to move with what works. And unfortunately, we've all experienced the pandemic where data and information was constantly changing.
Yes, absolutely. And now that we have artificial intelligence, this type of technology can filter through all of the data and then produce an answer to your question. But it's really important to test it. So what are some reputable sources for patients who just want to know more, maybe about their diagnosis of migraine or chronic pain or seizures?
Yes. Now, some of the most reputable data, it's kind of harder to read, especially if you're looking at peer-reviewed articles. PubMed is often the go-to source for peer-reviewed journals and articles that have valid research and a lot of experience going into it. But that being said, they're not the most easily digestible articles.
It's not light reading, for sure. They do have something called an abstract, which is an abridged version of the entire, article. But I think Up to Date and Medline are two really good sources. But again, if you don't know what you're looking for, you may end up finding accurate information, but it doesn't apply to what's going on in your body.
I honestly think that the best source is really your physician.
Yeah.
And with the advent of social media and different technologies, your physician has an unprecedented platform to give you, the patient, information. And it allows you to have this expert consultation or this expert filter of information. So I highly recommend looking at websites of reputable physicians and just following their posts, because they're not talking about experiments, they're talking about their everyday life and their real life experience with patients. And that's one of the reasons why with our practice, our direct specialty care practice, we're very involved with the information that's out there. We have a social media presence as a way to interact with patients, but also to educate. And it's a good way for patients to learn about the issues that they're struggling with, and also to find doctors who are experts in that. It's a very tall task to ask a patient to sift through the entire World Wide Web, to sift through PubMed, to find what is the best treatment for low back pain. There's so many different treatments out there. And yes, there are conservative therapies, there's interventions, but how do you know what stage you're at? How do you diagnose yourself? And the reality is you need an expert to help you on that journey.
Yes, and I would even go as far to say there are some patients that are medical experts. I've been a patient myself, and I try not to diagnose myself either. There's the human body is amazing, and it's complex, and it really does require expertise. So thank you so much, and we will be speaking more on this topic on Healing Talks with Kingdom Docs.
Please visit us at kingdomdocs.com. God bless.
Bye-bye.